Encephalic is the head. Okay. So that we're going to expect that very soon. This brachiocephalic is actually called a trunk. It's very short, or artery, brachiocephalic artery. It's going to very quickly branch, right? Like right here. That's why I came to this one because you can't see it very well, right? But this here is the brachiocephalic artery right there, and it's going to branch, and you can't see it because it's behind this other two veins here. It's going to branch and become the right carotid artery and the right subclavian. And there it is right there. You can barely see it, just a piece of it. All right? So that's the brachiocephalic. Okay? So there it is right there, the brachiocephalic. Okay? Now in the book, it'll show better pictures of it. All right? In this model here, now it's chart here, it's showing it again as a brachiocephalic. All right? So there's only one of those. That's the key to remember this. All right? All right, so the next one, so if you have this becoming the right carotid and the right subclavian, right, then this here, the next one, is the left carotid. And then the left subclavian. All right, brachiocephalic, then left carotid, left subclavian. All right, that's, you're going to start memorizing, that's the first, these are right here are the ones. All right? Because I can already hear it. 10 questions already, all right? Everybody knows what the brachial artery is. It's right here, right? Everybody knows what the femoral artery is. Where's that? Where's the femoral artery? In the upper leg, all right? Everybody knows what the renal arteries are. What do? They feed the kidneys, okay? So that's pretty straightforward, all right? And while you're underway, I will go and make copies of the chapter on the blood vessels to give to you because it has what I want you to know. You can cross off the list of what it is here. All right? So, but this is the heart here. Okay? Any questions about it? So, anterior, posterior view, the major structures of the heart. Okay? All right, so now, and I've taped this guy together so he didn't fall apart. Here it is here. All right, so on this model here, superior vena cava. Right? What is this? If this is the superior vena cava, then what must this be?
Let's see.
This would be the left brachiocephalic vein.
Let me see in the front. Okay.
So it's coming in with the right one and then becomes the superior vena cava. So the way to memorize this stuff with arteries and veins is that, like I said, arteries move away from the heart and they feed areas, so they will branch into smaller and smaller. The veins recombine and drain stuff and become bigger and bigger. Okay? So here's your superior vena cava, right? And then down here is your inferior vena cava. All right? Right here, I got the tape on it so it doesn't fall down. Right? Here's your pulmonary trunk. Right? This becomes the left pulmonary artery. And then on the back side, you'll see the other half, the right pulmonary artery going off to the right and left lungs. Okay? All right? So they give up carbon dioxide, pick up oxygen, and when they come back, right, I didn't really show it here on these small models here, but they come back in pairs. So right here, this pair coming back from the right lung would be the right pulmonary veins. Even though they look red, they're veins because they're coming back to the heart, right? And then over here, these two here are the left pulmonary veins, okay? So this here must be the left atrium. Here it is here, and there it is there, okay? All right? So here's your ascending aorta here, aortic arch, right? Brachiocephalic, left common carotid, left subclavian, okay? Or should I do the data?
Don't do that no more.
Okay. All right, so are we okay with this? All right. All right, so let's, no, I want to keep this on. I knew that was going to happen. All right, so it does it in chips. That's all right. All right, so let's leave that on. All right, and so, right, so right ventricle, left ventricle, atrioventricular, excuse me, interventricular sulcus, right? So you open it up. Now that's the thing when you do the dissections, right? And many of the hearts are already dissected, so that's fine. But when you open it up, right? If this is the left ventricle here, when you open it up,
I'm sorry.
here it stays the left ventricle, but the left ventricle is now sort of on the opposite side. It's to the far right. So you understand that artistically? So you got it. So many times, it's like you're going like this because you're trying to match it up, and that's okay. And the dissected specimens are like that too. When you put it together and you flip it up, right, you have to say, okay, all right, so this is still the left ventricle, even though it's on the right side. So, all right, so we move this, and what we'll see is right atrium. The space here, forget the plasticky stuff, but the space here would be the space of the left ventricle. All right, and so right here, here's the pulmonary trunk. So right there is the pulmonary valve, right there. Okay, and if you look right in there, right, that's the aortic valve. All right, but let me follow the pathway. That's the way to do it. So right atrium, this right here is the tricuspid valve. These things here are chordae tendineae, and then they're attached to this thing called a papillary muscle. This one's broken away, it needs to be re-glued. But here on this side are chordae tendineae, and then papillary muscles there. Okay. So the blood goes in. Right here, it's pumped up through the pulmonary semilunar valve into the pulmonary trunk, to the lungs and back. Come back here into the left atrium. Right, goes through this here, which is the bicuspid valve. Right, then here's chordae tendineae and so forth. And then when the ventricle contracts, it's going to force the blood up through this aortic valve, up into the ascending aorta, and then you're off into the systemic circuit. Okay. So here you've got these little models here. So again, you open it up, right? And there is actually, in this case, the valve, one of the valves is like molded onto this side, right? But here's your tricuspid valve, bicuspid valve. But look, there's your purple is pulmonary trunk. So this white valve is the pulmonary valve here on this side. All right. So don't be fooled by the, what I mean? That's silly stuff. We're all adults, and we can kind of say, okay, I get that. It's molded differently. All right. So there's the pulmonary valve into the purple pulmonary trunk, right? Then here's the bicuspid valve, and then right there is the aortic semilunar valve. All right. Now right here, see this little dot right there? That's where blood, oxygenated blood, is then leaving and going to the heart itself, right there. All right. So that would be like the coronary artery. Okay, and so, yeah. Now, it's hard to see now. So if I was going to point to valves, I could point to this one pretty easily. If I wanted to point to chordae tendineae, I can point to that pretty easily. I would grab this and say, what are these individual things here? It's not really hard. It's hard to see the papillary muscles there and there where they are, but it's not easy to do. So I would use, this to do it, or the real thing, because in the real thing, it's pretty easy to spot. All right. So like on this side here, all right, so this is a different model. These are different kind. Okay, so these two are the same. Oh, guess what? Somebody broke the valve out of this one, and it's not colored purple either. Looks to be the same. See, purple, same coloration. So this is like the doctor's office has. Aorta. Here's the descending aorta. So there's the aortic arch right there. Yeah, so there's the descending aorta right there. Okay, so let's see. Stomach, liver, intestines, pancreas, spleen. This is the beginning of the small intestine here. All right, so then this would be the splenic artery going to the spleen. Okay, so now that we've taken this apart, then we see that here's the diaphragm right here, and there's an opening called the aortic hiatus, where the aorta comes through, all right? So it's coming through, and right away, when it comes through, and this will be later, I'll go over this again, but right away there's a trunk called the celiac trunk that quickly branches into 3 branches going off to the liver and the spleen and the stomach, all right? And then you have, would be called the abdominal aorta. This would be called either the descending aorta or thoracic aorta, right? So the abdominal aorta. And you have then the right and left renal arteries, and then right and left renal veins in blue, right? The blue coming up is the inferior vena cava, and the red going down is the abdominal aorta. Up here, there's a place that shows where a vessel's cut, and then there's one down here where it's not cut. This is the superior mesenteric artery and the inferior mesenteric artery, and these arteries feed the intestines and these membranes called mesenteries. So you kind of see where they're coming from, right? But there's the inferior and superior and inferior mesenteric. These two here, depends. I don't know. Is this a male or female? This is a female, right? Ovaries. So this would be the ovarian arteries, or if you don't know, we call it gonadal arteries. This one here and there go off, and you can see they kind of go down to the ovaries, right? So that's this one and this one. Then the aorta bifurcates, which means it divides into equal 2 things. These become the, what bone is this right here? It's the bone you hang your health on. Hang your belt. The iliac. So these are called the iliac arteries, right and left iliac arteries. One is called, it then branches in part, it's called the internal iliac. That goes deep inside. The external stays on the outside. Goes off to the leg where it becomes the femoral artery, all right? And we'll talk about the other ones later. But when they come back, they're basically the same name. The only difference here is that you got the carotid artery going up and then the jugular vein coming down. Okay? So this is the jugular vein. All right? So this reminds me of a very important rule. All right? If you're ever out alone and a group of clowns come up to rob you and mug you, always go for the jugular first. There you go.